Today, I'm revealing the causes of back pain that most people never hear about. These are silent changes that build up over decades. Your discs shrink long before you feel pain. The process starts in your 40s, but symptoms often don't show until your 60s. Ligaments stiffen as collagen breaks down. When they lose elasticity, even simple movements strain your lower back. Spinal stenosis often progresses silently. Many seniors don't recognize it until walking becomes painful. Deep stabilizer muscles weaken first, not the ones you see. When they fail, the entire spine loses balance. Posture changes millimeter by millimeter. Over decades, this shift places massive load on your lumbar joints. Aging nerves become hypersensitive. What was once mild stiffness can feel like sharp, burning pain. Chronic low-grade inflammation slowly damages spine tissues. Most seniors don't know it's happening. Bone spurs are your body's attempt to stabilize the spine, but ironically, they often pinch nerves and worsen pain. Tight hip flexors pull your spine forward. They're one of the most overlooked causes of senior back pain. Weak glutes force your lower back to do extra work. This imbalance leads to chronic discomfort. You're tallest in the morning. As the day goes on, compressed discs trigger afternoon back pain. Years of bending create micro tears in ligaments. They heal poorly with age, creating persistent soreness. Even slight irritation of a nerve root can cause pain down the legs. This is why older adults often mistake back pain for hip or knee problems. The sacroiliac joint becomes unstable with age. It's one of the most common but underdiagnosed sources of pain. The multifidus is your spine's stabilizer. When it weakens, every step becomes harder on the spine. Thin cartilage increases friction between joints. This causes the deep, dull pain many seniors describe. A stiff upper back forces your lower back to rotate more. This imbalance leads to chronic strain. Fascia becomes sticky with age. This tight web restricts movement and contributes to stiffness. Stress increases muscle tension. For seniors, emotional stress often shows up as physical back pain. Poor sleep posture compresses discs overnight. Many seniors wake up stiff because their spine wasn't aligned. A rotated sacrum throws your entire spine off balance. It's a silent cause of chronic lower back pain. The protective coating around nerves thins with age. This makes nerves more reactive and painful. Even mild dehydration worsens disc compression. Seniors should drink more than they think. Small spinal rotations accumulate over time. These micro-movements create uneven wear patterns. A weak pelvic floor destabilizes your lower back. They work together more than people realize. Nerves are meant to glide. When they stick, you feel tightness that stretching alone doesn't fix. Everyday lifting becomes risky with age. The spine can't absorb stress the way it used to. Uneven walking patterns send uneven forces into your spine. Seniors often don't notice their gait has changed. The tight hips limit rotation. Your lower back tries to compensate, leading to pain. Fascia dries with age, creating friction between layers. This stiffness limits flexibility. Your ribs attach to your spine. Reduced rib mobility makes your back work harder while breathing. Disc bulges rarely happen suddenly. They form slowly, often unnoticed for years. When discs lose hydration, they lose height and cushioning. That forces your nerves and joints to absorb more impact. Pain when bending forward is often a disc issue, not a muscle problem. The disc pressure spikes in flexion. Facet joints wear down over decades of use. When they swell, you feel stiffness and deep aching. Many patients think it's pain traveling to the leg is usually nerve irritation. Even mild disc bulges can trigger it. That's why leg pain and back pain often appear together. Next.
Years of slouching slowly reshapes the spine. It shortens the front muscles and overloads the back joints.
Bone spurs grow as your body tries to stabilize the spine, but they can pinch nerves. Many patients don't feel them until the pain becomes chronic. A bulge is mild, a herniation is severe, but both can cause pain. The key difference is how much the disc pushes into nerve space. Dehydrated discs are less flexible and more vulnerable. That's why morning pain is so common. Your discs rehydrate overnight but stiffen again during the day. Inflammation is the quiet driver of pain. Even when the spine looks normal on scans, inflammation can trigger intense discomfort. Thickened ligaments crowd the spinal canal. It's a major cause of stenosis, one of the most painful age-related back conditions. Spinal stenosis narrows nerve space. Walking becomes exhausting. Leaning forward brings relief because it opens the canal slightly. Tilt changes your entire spine alignment. It forces your back muscles to work harder, which leads to fatigue and tightness. When cartilage wears down, bones rub directly. That mechanical stress creates deep, aching pain that worsens at night. Nerve space shrinks naturally with age. Even a small reduction can cause burning pain, numbness, or weakness. Rotation compresses the facet joints. If the joints are inflamed, even light twisting triggers sharp pain. Microtears accumulate over years. They cause slow, chronic soreness, especially after activity. Lower blood flow means slower healing. This is why older adults recover slowly from back strain. Slower nerves amplify pain signals. It's one reason that chronic pain becomes more noticeable with age. Poor neck posture overloads the spine. It increases pressure all the way down to the lower back. Extra weight compresses the spine. Even a 10-pound loss can reduce pain dramatically. Weakness on one side forces the other to overwork. That imbalance fuels chronic pain. The stiffer your spine, the more stress every step creates. Mobility training is essential. Stiffness after sleep comes from fluid shifts in the discs. Gentle movement helps redistribute pressure. Spasms are protective. Your body locks the muscle to prevent injury, but they create intense pain. When discs shrink, the spine becomes unstable. That instability causes unpredictable pain. Stiff tendons reduce shock absorption. This increases force on the lower back. A weak core forces the lower back to compensate. Strengthening the core reduces pressure instantly. These movements load the spine. When the tissues are aged, they react with pain quickly. Stiffer tissues limit movement and increase strain. This contributes to chronic pain. Weak extensors lead to poor posture and pain. Strengthening them improves stability. Osteoporosis makes the spine fragile. Small fractures can cause sudden, intense back pain. Swelling increases pressure inside the spine. This makes movement painful. Long-term pain sensitizes the nervous system. Even mild signals feel intense. Back pain in older adults has many causes: disc aging, joint wear, nerve changes, and inflammation.